that's there. So yeah, so this is the session that I will be sharing today. It's to be managing quality in health and social care. It's LO3 that I'm covering. It's to be able to evaluate systems, policies, and procedures in health and social care services. So the indicative content will be to evaluate systems, policies, and procedures. And we will evaluate quality systems and procedures, and we'll talk about what factors influence these systems and procedures, and we'll talk about what suggestions there are for improvement. So a bit about the terminology. So what are policies and procedures in health and social care services? So a procedure, by definition, in health and social care, it's a written setup. And this is a written setup of step-by-step instructions. So there's a detailed step-by-step the set of instructions, how a specific activity has to be conducted. For instance, if there's a case of medicines administration, there is a procedure that you have to cover. Even as simple as history taking, that is there in as a step-by-step instruction for everyone to access. And what is a policy? It's a clear document that indicates the position and values of the organization on a given subject. So for instance, if there's a policy on infection control in a certain setup, how would the organization intend to comply with the national standards, and what would it do to achieve best practice? So this is the written operational statements and documents of intent, and this explains the organization's stand on a subject and why there is a rule about it. A policy will basically mean it's a guidance towards a certain outcome, and that is for a certain organization. So for instance, if there's an eatery or there's a restaurant, you would have different policies for safety in that restaurant or that setup compared to a setup when it's a healthcare setting. And what is a procedure? It is a written set of instructions. So a procedure, as the name is evident, it's a sequence of events or a particular act. So step by step, the procedure has to be explained in a document. So these aid policies, these help policies to be in place, and describe how the policy would be implemented and met. So the policy is in place, but how it has to be met is through a procedure. So a procedure on infection control, this will provide you a step-by-step process or instructions on how to actually control the infection from the first step to the last step. And what is a protocol? It is a written plan, and this written plan will specify the procedures that have to be followed in defined situations. So it represents a standard of care, so that describing an intervention or any set of interventions. So they'll be telling you what you will be doing, how you will be doing, and when you will be doing. It gives the whole guideline. And what is a guideline? So there are different definitions that we are talking about. So a guideline is a defined set or a principle or a criterion, and you have to adhere to it in order to achieve the outcome. So it emphasizes using clear evidence, and that's from previous research, and that doesn't come from just opinions, not expert opinions. It comes from proper researched subjects. So doing the right thing on a day-to-day basis, it's very essential to achieve best outcomes for patient safety and service and safety of the service users. And satisfaction increases, obviously, if it's done on an everyday basis. That is, and you're adhering to it, that is of utmost importance in achieving the best outcome for anyone whoever the client is. And it's retention talented staff also, because the talented staff would go elsewhere if there's no proper guideline available, and that's good for financial performance overall. So what is the importance of policies and procedures in social care services? So they're there to influence and determine all the major decisions, or whatever has to be have to be made, and whatever actions have to be taken within a social care setup, and all the activities that take place within the boundaries set by them. So procedures, we talked about policies and procedures. So procedures are specific methods. These are, again, so policies are there, but how do we carry out those policies? How do we implement those policies? These are through procedures. So they're there to help you on a daily basis. So together, these ensure that a point of view is held by the governing body of an organization and is translated into steps that result in an outcome compatible with that view. So let's watch a video on how NHS in the England works and how they work about their policies. Just yeah. I'm just making sure that my screen is shared. Just a minute. Yeah, so that presentation was basically, that video was basically showing how the NHS is working and how to make it that working more effective for every individual. So there are obviously resources, and we need to make sure that we're using them to the best of our ability. So this point now that I would talk about is to evaluate the effectiveness of systems. How do we evaluate systems, policies, and procedures that are used in health and social care settings, and in order to achieve quality in health services that are offered? So within Shaw Hospital, it has implemented several systems. I'm giving an example of this hospital. So because this is one example that is shared widely. So policies and procedures, they are there to improve the quality of care and to meet the standard requirements. So some of them have proved to be effective in providing quality, while others are completely ineffective. We'll talk about how that has happened. So there's a black alert. We know black alerts are there when we do not have capacity to deal with the situation. The setup doesn't have the capacity to deal with the situation in a setting, in a healthcare setup. So that was there in the year 2012. So within Shaw Hospital, it experienced a situation where there was a patient who had to wait in the recovery until a bed was available in the ward. So this hospital was able to deal with this situation with an increased risk for the patient. So a communication system was established and this alerted the theatre personnel of the bed capacity situation at the ward. So then there was an electronic risk management that was working there. It was used to alert when patients stay at recovery unit, and when their patient stay was extended. These communication systems, they improved the situation overall in the recovery unit, and the hospital then knew that patients only stay there for the appropriate time, and they're transferred to the ward immediately once they're medically fit to be transferred. So they're not staying there for a longer period of time in order to deal with that situation of having no capacity at all. So according to the NICE guidelines, care providers, they're required to assess physical and psychological needs of patients, the different needs of the patients. So they have physical needs, they have mental needs. In order to comply with these requirements, the hospital established the hydration bundle policy, and this aims to monitor fluid intake and output on a regular basis. So this policy was set up there, and then it had to have procedures. Obviously, this policy was to ensure patients were well hydrated. And according to the inspection by CQC in 2014, the hydration policy was ineffective since 90% of the fluid recordings charts were not filled as required. So that made this whole policy very redundant. The hospital also established a comfort round procedure, which was used to monitor the welfare needs of the patients. This procedure was working for the hospital, and the patient's needs regarding welfare were being assessed, and they were being provided. Although this hospital within Shaw Hospital had in place the needs assessment and care and treatment planning, the system did not meet the standards and as required by the Care Quality Commission, CQC. This then the trust had to also put in place a strategic framework for risk management. So if you have proper risk management in place, that is how you manage different cases on a day-to-day basis. So this system had improved the reporting, collating, and management of different incidences that took place in that hospital premises and risk across the entire hospital. Again, there was a Care Quality Commission inspection that found that some aspects of the system were not working effectively. Electronic tagging devices for tracking and monitoring patients at risk of wandering were not being used effectively. This was again the report. So there were policies there, but those policies were not being adhered to and procedures were not being followed. So we are analyzing other factors that influence the achievement of quality in health and social care services. So achieving this quality care services, it's quite crucial, and it's not always possible for every organization to achieve quality when you're delivering services. So what are the factors? We need to know, if we know the factors that influence the achievement, this achievement of quality in health and social care services, this is how we then know how to tackle these factors. So when we're delivering quality health and social care services, it's dependent on a number of factors. So the availability of resources, proper, appropriate skills for quality delivery. So you might have all the resources available, but you're not able to provide skilled people for accessing those services. Perception and expectation of health users. These are some of the factors that influence quality. So for successful improvement of quality, what the hospital did, it used a lot of financial resources, and those were used, and policies and procedures established were then assessed. For instance, financial resources, according to the hospital, they're required to train the staff on how to use some of those training and upgrade their skills. And this was a recommendation by CQC. The amount of money available or allocated to the trust will therefore greatly determine if there's ability in improvement of the quality of services. So then when you see that you have all the resources available, but then are you using those policies and procedures according to what is expected? So the perception of healthcare staff has it also affects achievement of quality. For instance, if there's achievement in this hospital, the healthcare staff at the hospital, they needed to have very high perception, very positive perception towards improvement of quality. Their perception improves their behavior and commitment to quality. So if they have very positive perceptions and they have a positive mindset towards improvement of quality, this is how they will work towards it. Perception and expectation of the service user is very important. It also has to have, it also influences the achievement of quality service. The higher the service user has their expectations, the more efforts have to be put in. So they're spending more because they expect more from a private sector hospital, for instance. The expectations, if they're higher, you will have to perform higher again. And even if they're not spending higher, if they have expectations from the healthcare setting, if they're not spending at all, and they're just coming and spending time there, that also is an expectation. That also generates an expectation. And then legislation, there's a Data Protection Act 2016, you have Health and Safety Act, you have Care Act 2014. There are many other legislation procedures that should be there while you're talking about quality and improving quality. Training of staff is very important on a regular basis. There are CPD requirements that should be there in place, and staff needs to adhere to them. The culture and structure within the NHS, the organizational structure within the hospital, that also has an influence on quality. So what are the ways suggested in which health and social care services could improve their quality? So this hospital, according to CQC, it has recorded a significant achievement in quality improvement. There still is a need for further improvement in order to achieve better quality. So there are several ways in which you can achieve this objective, because several issues were highlighted which included staff capacity, capability, supervision, staff monitoring, use of proper procedures, if those procedures are being followed properly or not. So according to a study in 2013, staff are staff are key determinants in delivery of quality care. So if the staff you work upon the staff, you actually work upon the quality, improve the quality. So within Shaw Hospital, should ensure that there is a system in place for training its staff to sharpen their skills, to improve their skills, to enhance their skills and their knowledge. So when they're doing this, because if you're using resources, it's of no use if the staff doesn't have the ability and the skills and the knowledge to use these resources. So this hospital will be addressed a number of issues as identified by CQC in its quality report. This was mentioned by Gordon et al. So this then would close the gap, the knowledge gap that is identified. Inadequacy of the staff would also be addressed, and still skilled staff will be more able to perform in situations where resources are available, but the staff is not available because they don't have the capacity. So according to CQC, staff were not following some of the policy systems and procedures that were established in the hospital. CQC found out that the hydration bundle policy was there, but it was given, the management was not there in supervising and monitoring the work of the staff. So the staff did not adhere to the procedures. There was an important point on empowering staff. So this was through several indicators that they found out that the staff was not empowered enough to actually work as they should be working. Training and development of the staff for regular across the year. So you're spending on the staff, but you're actually spending on your own self, on your own organization. There should be regular audits and inspections done internally by the management. So then when there's an external inspection, you should be clear on that you've handled it properly. Set higher standards than the requirements or as prescribed by CQC 2014. So these are some of the references that you can access. Any questions that you have, any queries, please email on this email address. And your submission would be, obviously, of your assignment would be 2 weeks after completion of the units and its delivery. Any questions, please let me know, and I'm happy to take them. I will stop sharing and I will end this meeting. Thank you so much for listening. Take care and goodbye.